Thank you, Dr. Joff.
Senator, I had a question.
Senator Dela Cruz, sorry about that. Senator Dela Cruz. Go ahead, Senator.
Okay, thank you, Chairman DePalma. I was just thinking about what Senator Acosta was saying, in that it will impact low-income communities more. I was just looking at some of the numbers here, and just for a 1 liter of soda, it would cost an extra $1. So if a family were to just buy a 2 liter at $1, they've doubled the cost of this this beverage. A 12-pack of soda would cost an additional $2.16. A canister of maybe a lemonade mix would be almost an additional $4 in just the tax. And small businesses would be taxed at $57.60 per bag of the boxed bag of soda that they mix with water for fountain drinks. So there is a significant impact. And then I was just thinking about, no, I'm not a dietitian, but having 3 boys at home, I know that when they're eating sugar, say as you had used an example of, ding dongs and Twinkies, those I feel like those could be consumed in just 1 sitting if a child was allowed to do it. Whereas a sugary drink like soda, because of the gas, kind of fills you up. So I wonder also, should we be taxing things like orange juice? Now, I'm not advocating for the tax because I think we shouldn't be taxing individuals. But should we be taxing orange juice and apple juice and grape juice, because those are very high in sugar as well? And then what about no-calorie sweeteners, sodas, things like that have stevia or, natural-based sugars that don't impact the caloric intake or your sugar levels? I know that was a big question. Thank you, though.
No, thank you. And there's several components of that. So let me start with the last part first. Which is around other kind of, artificial sweeteners, Diet Coke, those kinds of things. We have no evidence that they contribute much to obesity. And in fact, there is what we've seen in other places when sugar taxes have gone in, is that there's been a substitution. And so people will often switch from Coke to Diet Coke, or they will often switch from Coke to water, or because people like to have a beverage with meal. In terms of consumption amount, your other question around, does it fill you up? What we've seen, and there's very good data on this, that kids, and sometimes adolescent, but even often younger kids, will end up consuming very vast quantities of soda over the day because they may be sipping it along all day. And we've seen very good evidence that, again, it ends up contributing massive number of calories in a way that you don't see with Ho-Hos and Twinkies. Because of the ease with which it's easy to kind of sip along and have a big thing of soda that you're drinking for many, many hours. So that's one of the issues. I completely agree. You probably couldn't sit and drink a whole liter of Coke at 1 sitting, but if you space it out over 15 minutes, half an hour, a couple hours, and that's just been the experience that we've seen with the data. So this is why I think all of us, and I'm always hesitant to tax things, especially food products that are going to end up affecting people. But this is such an egregious offender of obesity in kids particularly. And we know that that obesity in kids really does disproportionately harm certain communities. That this kind of tax has always made sense from a public health point of view. And why I don't necessarily favor broad sugar tax, because it does start having these broader effects. In terms of the size of the tax and whether this tax is too much, I know that came up with Senator Acosta as well. Again, and I think at the end of the day, the Senate Finance Committee is going to have to decide what is that right amount. In my mind, you want it to be big enough to move people away from and substitute other drinks. And that's why I think the 1.5 cents per ounce has made sense to me. Last quick point, just to answer the question of why not apple juice, orange juice. First of all, they tend to be much more expensive, so people don't consume the same quantity. Soda is very cheap, so that's one of the reasons why people can consume very large amounts. And so we just haven't seen the same level of consumption. Obviously, you can also get obese from apple juice and orange juice if you're drinking 48, 72 ounces, a day, but that just rarely happens. It's so infrequent that that's one of the reasons why, in general, it hasn't been targeted.
Thank you, Dr. Jha. Senator, you have one other follow-up?
Just a quick follow-up. I guess my concern is if we're going to be fair, we should apply the law equally across the board to all sugary drinks and even maybe sugary foods. Now, I'm not advocating for it because I don't like the idea to tax, food or drink. I think maybe a public campaign and I think the previous administrations have done a good job of highlighting how important it is to eat healthy foods. But to pick and choose winners and losers, this is, I guess, a discussion for the committee. Is that really fair? Is that equitable? Thank you so much for your time. I had no idea that someone had just texted me and said you're on CNN and all these other news agencies, so I appreciate your time. Thank you.
Absolutely. Let me just quickly address that issue of picking and choosing winners and losers. I'm completely sympathetic, and I think if the issue was we were randomly picking on one product, or certainly picking out, let's say singling out a single company or any of that, I would be very concerned. The issue here is this is really where the data is. The evidence is very clear that the major driver of obesity in kids, a major driver from a food and drink point of view, is sugary beverages. Yes, other foods also contribute, they vary, but if you look at the major contributors, this one just stands out on its own. So you're not picking winners and losers, you're looking at the data of what's out there and what is driving obesity in these communities among children. And I think you're asking yourself, what can we do to lower the level of obesity? You can tax other things, they're just not going to have the same kind of impact. You're choosing to focus on what really is driving obesity among kids. And to me, you're letting public health drive it, not so much we're picking one drink over another.
Thank you, Dr. Jha. Thank you, Senator De La Cruz. Dr. Jha, thanks again for testifying, and much appreciated.
My pleasure. Be well, everybody. Stay safe. Thank you.
Thank you. Next up, I believe we have Andrea Heath. Good evening, Andrea. How are you tonight?
I'm well. How are you?
Thank you. Welcome to the Senate Finance Committee. If you can please try and keep your comments to 2 minutes or less, it will be appreciated. Thank you. Over to you.
Absolutely. I'm great. Thank you to the Senate Finance Committee for hearing my testimony today in support of Senate Bill 0327. So fresh fruits and vegetables are really expensive. I'm sure you all know that. And it's really hard to budget for them. Even with my SNAP benefits, it's usually not even enough to get me through the whole month. And we all know the importance of fresh produce. It's not only important for me personally to be a healthy individual for my own well-being, but it's especially important now in my role as a new mom. I'm breastfeeding my newborn, and when I consume a combination of fresh fruits and vegetables, it provides my son with the vital nutrients and vitamins and minerals essential for his development, not to mention my own. I also plan on, from my family, we plan on pureeing our own baby food. That's an important part of our plan, and, it's the fresh fruits and vegetables are going to be a big supply for our grocery list. And especially now that the news aired an investigation on how commercial baby foods are tainted with significant levels of toxic heavy metals, including arsenic, lead, and mercury. So that's all really scary to think about, which makes me want to keep my diet fresh and as possible. A diet high in fresh fruits and vegetables can protect me from cancer, diabetes, heart disease. And again, this is all just helping me, never mind my newborn son, who can't fend for himself, like he has to rely on me. So that's why I'm in support of Senate Bill 0327, and thank you for your time.
Andrea, thank you very much. Any questions from the committee for Andrea? Andrea, thank you. Next up, we'll have Christina Forts. Christina?
Hi.
Welcome to the Senate Finance Committee. If you could please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Christina.
Hi, I'm a mother of an overweight 10-year-old, so having this bill pass would be tremendous help within my household. You would be able to have more fruits and vegetables on the table if this bill is passed, and it will greatly appreciate. I think everybody in the community would be greatly appreciative of this bill. Thank you, guys.
Christina, thank you very much. Any questions from the committee for Christina? Christina, have a nice night. Thank you.
You as well. Thank you.
Next up, I believe, will be Michelle. Is this Michelle Girasoli?
Hi, yes. Thank you for having me tonight.
Good evening, Michelle. Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Michelle.
Yes, thank you. My name is Michelle Girasoli, and I'm a resident of North Kingstown, a parent, a business owner, and tonight I'm speaking as a steering committee member on behalf of Healthy Bodies, Healthy Minds Washington County, which is our county's health equity zone. Our group has been working to reduce chronic health problems and improve health outcomes in Washington County since 2015. As part of this work, we strive to improve community conditions to assure that children and families have access to the resources they need to live healthy lives. This includes making water more accessible than sugary drinks in schools and public places, and increasing residents' access to affordable fresh produce. Children in our region have been learning about healthy drinks, drinking water during the school day, and tasting a variety of fresh fruits and vegetables. This bill supports healthier drink consumption among all Rhode Island residents and will boost access to fresh produce at home for those families most in need, the SNAP recipients. This bill sends the message to our children that we care about their health and we want to do all that we can to encourage and support their healthy eating and drinking habits. Every child deserves to grow up healthy. Promoting healthy drinks like milk and water are important ways to help. The average kid drinks more than 30 gallons of sugary drinks per year, which sets them up for a lifetime of known health challenges, such as type 2 diabetes, heart disease, and tooth decay. That same child also eats only about half the recommended servings of fruits and vegetables each day, adding to their health risks. As we just heard, parents want to give their children healthy food, but sugary drinks are less expensive than milk and fresh produce. And so families with limited food budgets have difficult choices to make, and the pandemic has made stretching food dollars even more difficult. When surveyed by our local food pantry about what foods they wanted more of, many families asked for more fruits, more fresh fruits and vegetables. This bill is so important to our community since it would support us in reaching two of our most important community health goals: reducing sugary drink consumption and increasing access and intake of fresh fruits and vegetables. By supporting SNAP recipients in purchasing healthy food, we can improve their long-term health outcomes while garnering long-term health care savings through the reduction of chronic disease. I join others tonight in saying that this bill is a no-brainer, and I urge you to support the sugary drinks tax bill. Thank you for your time, and I'm happy to take any questions.
Michelle, thank you very much. Any questions from the committee for Michelle? Michelle, thank you. Have a good night.
You too.
Dr. Jim Krieger?
Yes. Hi, this is Dr. Jim Krieger. Should I start now?
Yes, Dr. Krieger, thank you for...
Okay, yeah. Okay, yeah, good evening, and thank you, Chairman Pearson and members of the committee, for this opportunity to speak with you today. I was asked to testify by Senator Lawson and the advocates supporting the bill, given my expertise in studying these types of taxes around the country, and I'm very happy to do so. My name is Jim Krieger. I'm a physician, clinical professor at University of Washington. and past co-chair of Seattle Sweetened Beverage Tax Community Advisory Board. And I'm here to support Senate Bill 0327 because I know firsthand how beneficial a tax has been for my hometown of Seattle. We share your goals for the tax to increase fruit and vegetable access for vulnerable populations while decreasing sales of unhealthy sugary drinks. Our tax has been raising more than $23 million a year, and we're using these revenues to subsidize purchases of fruits and vegetables for people with low incomes. A community member who's used the vouchers told us, you take the bad sugar in pop, you turn it into good nutrition at the markets. That's a job well done. Thank you. Another said, I'm a diabetic, and with this program, I can eat a lot of vegetables, and I see improvements in my health. So besides fruits and vegetables, our taxes also have the benefit of decreasing sugary drinks by 22% sales-wise. So that's a great combination, helping people afford healthier diets while driving down the sales of diabetes-causing sugary drinks. A win-win for good health and good nutrition. Tax revenues are addressing important community needs in other U.S. sites, the 6 cities in the Navajo Nation in the U.S. My research has shown that in these cities, more than 85% of the revenues are invested in low-income communities. And because of these targeted investments, sugary drink taxes are a progressive and equitable policy. Furthermore, despite industry claims, we know that sugary drink taxes do not have negative effects on employment. In Philadelphia, for example, 2 peer-reviewed scientific studies have found no evidence of job losses in the overall economy or in potentially affected industries like supermarkets or restaurants. And in Berkeley, jobs have actually increased in the food sector after the tax. And now we have new data from Seattle showing revenues in small independent stores are not affected by the tax either. So at the end of the day, a sugary drink tax is straightforward public policy. It's about the lifelong health and well-being of kids and families of Rhode Island. Thank you for this opportunity to share my experience with you, and I hope you will support this bill.
Yep. Dr. Krieger, thank you very much. Any questions from the committee for Dr. Krieger? Seeing none, Doctor, thank you very much for being with us tonight.
Okay, thank you for having me. Good evening.
Thank you. Is this Councilman Derek Green?
Yes, speaking.
Councilman, thank you very much. Welcome to Senate Finance. If you can please keep your comments to 2 minutes or less, it would be appreciated.
No problem. Yes, for the record, my name is Councilmember Derek Green. I'm an at-large member of City Council in Philadelphia, Pennsylvania. I want to thank Chairman Pearson and members of the Finance Committee for allowing me to speak in reference to Senate Bill 327, which is Senator Lawson's bill regarding sugary drink tax. As a member of City Council, and I serve as an at-large member and also chair of our council's Finance Committee. But in addition to that role, I serve as a member of the board of the National League of Cities, as well as the president of the Pennsylvania Municipal League. And coming into the 2016 year, that's when we actually passed the sugar-sweetened beverage tax here in the city of Philadelphia. There were a number of concerns that people raised regarding this legislation. I myself started my career in the private sector, and as an attorney have represented various small businesses in the greater Philadelphia region and beyond. And so having that background, there were some definite concerns on my end regarding the impact this type of legislation would have in the city of Philadelphia. But what we learned is that this legislation in Philadelphia did not have the concern impact that we initially thought. We also had the opportunity to not only address the issue of health for constituents in the city of Philadelphia, we also were able to use the resources from our sugar-sweetened beverage tax as a way to reinvest in our city. In particular, we were able to provide resources for our community schools initiative, which is a program for young people and others after our traditional school day is done, as well as invest in a pre-K program for the citizens of the city of Philadelphia, as well as make a major investment in our parks, recreation centers, and libraries in the city of Philadelphia. Today was actually the first day of our budget hearings, and when we have some questions regarding the impact of the sugar-sweetened beverage tax in the city of Philadelphia since that time, we've only seen about a 1% reduction of those type of sales in stores within the city of Philadelphia. And this has been overall a benefit for our city in spite of some of my initial concerns This is one of the reasons why I supported this bill and continue to support this legislation, because it allowed us to make investments in our city in ways we could not have done without this type of legislation. So I want to thank you for the opportunity. I think this type of legislation will be a benefit for the state of Rhode Island and will provide your state, through the Nourish RI initiative, the opportunity to reinvest into those stores and also for your constituents of your state. Thank you for the opportunity testimony, and I'm free to answer any questions that you may have.
Councilman Green, thank you for being with us tonight. Any questions for Councilman Green? Hearing none, Councilman Green, thank you for being with us tonight. It's appreciated. So.
Thank you. You have a good day.
I don't believe there's any relation, but next we have up Leonard Green. Leonard, you there?
Yes, I am.
Leonard, welcome to the Senate Finance Committee. If you can please try and keep your comments to 2 minutes or less, it would be appreciated. Over to you. Thank you.
Thank you very much, Vice Chairman DePalma and the members of the Senate Finance Committee. At this point, I've changed my points about 7 times because a lot of my thunder has been taken, but that's okay because we're all basically in this together. I do want to mirror, first of all, let me just say that I was with the Centers for Disease Control for 12 years and with the State of Rhode Island Health Department for 33 years. I am now retired, so I'm only speaking on behalf of myself and the Rhode Island Public Health Institute, not the Department of Health. I do want to mirror Senator Lawson's comments about the parallels between the tax on tobacco and sugary beverages. We in public health garnered extensive experience relative to behavior modification and multifaceted approaches and behavior change, interacting and understanding industry and manufacturers. But the most important point I would like to make is that the restricted receipt opportunity in this bill is a major move forward. Having the money that is collected and actually allocating it to the intervention is a wonderful and innovative approach, and I hope that aspect of the bill remains intact. All of the other public health aspects have been mentioned and have been gone into depth. I won't reiterate. I just want to mention one other thing, and that is there was a WHO study that showed that a 1 cent increase on sugary tax drinks over 10 years would garner over $17 billion in healthcare savings in the United States. So there are not only changes in behavior, but also reductions in the cost in the healthcare system. So that is the end of my comments, and I open it up to any questions. Thank you.
Leonard, thank you very much. Any questions from the committee for Leonard? Leonard, thank you very much. Have a good night.
Thank you.
Thank you. I think we'll have, next up will be Dr. Stephen Gortmaker. Dr. Gortmaker?
Yes.
Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Thank you.
Sure. Thank you so much to all the members of the committee. My name is Steve Gortmaker. I'm a professor at the Harvard Chan School of Public Health in Boston, and I'm discussing the Senate Bill 327. And I want to talk a little bit about the science behind a sugary drink tax. I've studied the health effects of sugary drinks for the past 20 years. I co-authored the first study that documented how increasing intake of sugary drinks leads to increased obesity in youth. And other research have documented how reduced sugary drink intake will reduce obesity risk. And others have noted it's now well established that consumption of these drinks contributes to obesity and increases the risk of chronic disease, including diabetes, cardiovascular disease, and cancer. Sugary drink taxes, like the one being proposed, have been found quite effective at reducing sales of sugary drinks in settings throughout the world. And our research team in particular has calculated the cost effectiveness of sugary drink excise taxes like this. in preventing cases of obesity, chronic disease, tooth decay, quality of life, mortality, and in future healthcare cost savings. Our research has determined that sugary drink taxes like this are in fact cost savings, meaning they can be expected to save more in future healthcare costs than the tax will cost to implement. And I should note that these calculations don't include the tax revenue. And with your particular bill, you're going to get additional health effects because of the subsidies of fruits and vegetables. And we've studied taxes like this, evaluated these in many cities and states, including New Hampshire, California, Hawaii, Alaska, and Washington. Finally, I'd like to point out that because lower income populations generally consume more sugary beverages than higher income populations, the tax will have a greater effect on their consumption and thus likely greater effects on improved health. And because of this, I think the tax should be seen as progressive, meaning they will tend to improve health equity. Thank you for hearing my perspective, and I urge your committee to support this bill. Based on the science, I believe the sugary drink tax will prevent many cases of obesity and chronic disease and be cost-saving for your state.
Dr. Gortmaker, thank you very much. Any questions from the committee for Dr. Gortmaker? Senator Dela Cruz.
Thank you so much, Doctor. I think it's so important to hear from physicians, and so many have called in. But I do have a question because, of course, we want to make sure that children, have a great start, and that includes eating healthy and drinking the right beverages. But I was looking at a study done. Let me just pull it up here, and it says here, an examination by the New Zealand Institute for Economic Research looked at 47 studies on soda taxes around the world and found no evidence that any sugar tax actually implemented anywhere in the world has led to improvements in health. A study by McKinsey and Company found that soda taxes were largely ineffective at combating obesity, and that existing evidence indicates that no single intervention is likely to have significant overall impact. I'll state it here as well. It says Bentley writes that advocates tend to count any drop in soda sales as a victory, no matter how small or aggressive, or whether it achieved any positive health benefits. And lastly, quoted, the desire to raise revenue for public programs is no crime, he wrote, but it shouldn't be masked under the guise of public health. So I hear what the physicians are saying, but then I read evidence stating otherwise. What do you feel about this study?
Mm-hmm. Sure. Thank you for those comments, and I understand how excuse me, are you still talking?
Nope, go ahead, doctor.
Okay. I got confused there. I understand your concern. Just like when tobacco taxes first came in, it takes a long time to see the health effects of those kind of changes. And I think the same thing is true with a sugary beverage tax. The first thing you'll see is a decline in sales of the beverages. Then you'll see a decline in consumption. And it'll take quite a while, but then you will see this impact on excess weight gain. And as you know, weight gain changes slowly. The average adult and child, actually, in the United States gains an extra maybe pound a year that they don't need. It takes a long time to gain that weight, and it'll take a while for that weight to go away. But the calculations we've made take those slow processes into account, and it will take time. And so the evidence, at least from my perspective, is quite clear that this tax will have these health effects, but it won't happen overnight.
Thank you, Doctor. Thank you, Senator. The next up for testifying tonight will be Dr. Phil Chan. Stand by. Dr. Chan?
Hi, hello.
Good. Welcome to the Senate Finance Committee. If you can please try and keep your comments to 2 minutes or less, it would be appreciated. Thank you. Over to you, Dr. Chan.
Great, thank you. I'll be brief. My name is Philip Chan. I'm a community physician and Chief Medical Officer of Open Door Health here in Rhode Island. I'm also an Associate Professor at Brown University in the Department of Medicine and School of Public Health. I'm here testifying tonight in my capacity as a public health and clinical physician. I've dedicated my career to public health practice and addressing health disparities, as well as the clinical care of underserved community. This is why I am testifying tonight in support of Senate Bill 0327. I want to emphasize that this bill would go a long way to promote public health and the healthy eating habits for Rhode Islanders, and especially Rhode Islanders from lower socioeconomic backgrounds, many of whom are struggling right now, of course, during the COVID pandemic. I've been alarmed with how our childhood obesity rates have risen in recent years in Rhode Island. I was actually surprised to learn a few months ago that we were now ranked 11th in the state of Rhode Island for childhood obesity. Due to the marketing tactics of the beverage industry, sugary beverages now more commonly consumed by low-income families and families of color, which are contributing to the higher rates of chronic diseases such as diabetes, which are more prevalent in these groups. And as has been mentioned by numerous people, in places that have implemented a sugary beverage tax, this has led to less sugary beverage like soda. Furthermore, as others have pointed out, the proceeds from this tax will be used for a positive public health effect to increase access to SNAP incentives in grocery stores, which will benefit all Rhode Islanders, and especially those from lower socioeconomic backgrounds. Many of my current patients currently work in the hospitality and service industries. Their lives have been significantly disrupted by the pandemic, and many people are now struggling. Hunger is at record high levels in Rhode Island, and this bill will help address that public health crisis by making fruits and vegetables more readily accessible. And finally, on a personal note, and as a parent of a 10 and 13-year-olds here in the town of Lincoln, I would never, ever want my children to be targeted for predatory marketing by the beverage industry or to consume such a large quantity of sugar. There's no question in my mind that this bill would go a long way in promoting the health of all Rhode Islanders. I enthusiastically support Senate Bill 0327. Thank you very much.
Dr. Chan, thank you very much. Any questions for Dr. Chan? Thank you very much, Dr. Chan.
Thank you. Have a good night.
Good evening. Is this Shara Hirschberg?
Good evening, this is.
Good evening, Shara. Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Thank you. Over to you.
Thank you, I will. Hi, everybody. As was said, my name is Shira Hirschberg, and I live in Providence. I'm a registered dietitian and on the board of directors of the Rhode Island Academy of Nutrition and Dietetics. That's the local professional association of dietitians in the state. I and we support S327 because this bill is a fantastic way to achieve two public health benefits at once, to reduce sugary beverage consumption and increase accessibility of fresh fruit and vegetables for low-income Rhode Islanders. Today, I'm going to focus on the impact of funding the Retail SNAP Incentive Program because this is what I know would be so helpful for many of my clients to receive SNAP benefits. For all of us working in the community, we really believe this would be something that could benefit lots of the folks we work with. So I'm going to tell you a story of one client I worked with last week. This client lives in a state-supported independent housing location, and this is his first year preparing his own food. This is especially challenging because he has very disordered eating, food allergies, and sensory difficulties with the texture of many foods, as well as other mental health difficulties. Thanks to telemedicine, I was able to be on the phone with him for our appointment while he went grocery shopping. He generally has $190 per month in his SNAP benefits, which is a little more than $6 per day, and will be reduced after the state of emergency ends. For the grocery store trip I was on with him, he had $70 that he could spend and a limited time period to shop. He started in produce, and we talked about the most affordable options. Unfortunately, he has sensory aversions to most of these foods that are most affordable, like apples and bananas. They make him gag when he tries to eat them. So he got strawberries on sale and pears, and decided to save money on vegetables by getting them canned. As he was adding items to his cart, I tell him I think he's already gone over the total he has to spend, and he heads to the register where he's indeed gone over. He actually has agoraphobia, and so I had to coach him through asking someone to help return some items to make sure he can afford the total. He finishes and leaves, and I realized that he missed the canned vegetables that we talked about because we decided he'd run out of money before he got to that part of the store. Having that 50% discount on fresh fruits and vegetables would have allowed him to get his 2 fruits as well as some fresh vegetables while in the produce area. This is just one example of a client who struggles with their grocery store trips and could be really benefited by the SNAP incentive program. Thank you for your time and attention. I'm happy to answer any questions.
Shira, thank you very much. Any questions from the committee for Shira? Shira, have a good night. Thank you.
Thank you.
Next up to testify is Allison Ventura Tasillo. Welcome, Allison, to the Senate Finance Committee. And if you can please try and keep your comments to 2 minutes or less, it would be appreciated.
Okay, I will try. So let me start by thanking the Senate Finance Committee for hearing my testimony this evening. And I think after this, we're all going to need a nice drink or some coffee or something because I'm tired, and I know you guys are as well.
No sugar in your drink, though.
No sugar, though. My name again is Allison Ventura Tasillo, and I am the Community Wellness Coordinator and a Community Healthcare Worker for Puerto Rico Latino. As a community healthcare worker, my clients have said how difficult it is to make ends meet. Most of them receive SNAP benefits and have mentioned the funds they receive do not last the whole month. They have expressed how the healthier food choices are always more costly than the quote-unquote junk foods or less healthier foods. They want to provide more fruits and vegetables to their families on a regular basis, and not only when they become available through sales. We wish for the sugary drink tax to be implemented to allow SNAP recipients the ability to stretch their funds and provide families with fresh and healthier food options. Thank you for your time.
Thank you very much, Allison. Any questions for the committee? Allison, thank you very much for your testimony tonight. It's appreciated.
Thank you.
I think coming up will be Dr. Whitney Evans. Dr. Evans?
Yes.
Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Doctor.
Thank you. Thank you, Chairman Pearson and members of the committee, and for the opportunity to speak tonight in support of the Sugary Drinks Tax Bill, or SB 0327. I am both a registered dietitian and a nutritional epidemiologist whose work focuses on the role of diet in excess weight gain, with a particular focus on youth from low-income communities. In my written testimony, I cite several studies that comment on the quality of diet in children living in SNAP-eligible and SNAP-recipient households. The highlights I'd like to make tonight differ from those of the previous testimonials, and that they show how low diet quality is in these households. And this is particularly due to the lack of resources experienced in these homes, as well as the lack of resources that families face towards the end of the month. In particular, average diet quality is 46 out of 100 on the Healthy Eating Index score, which suggests that most individuals living in SNAP households are failing with respect to the quality of their diet. And we see that this quality decreases by another 3 points over the month due to decreased intake of specific fruits and vegetables and the lack of funds at the end of the month. Perhaps more concerning is that youth living in these households consume increased energy, fat, and sugar, and fewer vegetables as compared to youth from higher income households. This bill has the potential to address health disparities in 2 primary ways. First, by taxing sugar-sweetened beverages, behavioral economics suggests that families with fewer financial resources will be less likely to purchase sugar-sweetened beverages since they will cost more. This will have a disproportionate benefit given that children from low-income households consume sugar-sweetened beverages on average of 76% of days. Second, the tax revenue generated from this bill will serve to help these very same families increase their SNAP benefits by extending their funding and doubling their SNAP benefits to purchase fresh fruits and vegetables. Whereas this benefit currently exists only at farmers markets, those are few and far between in comparison to grocery stores, particularly in the winter months. I implore you to consider this bill and to give it its full bearing, particularly given the fact that it has great potential at reducing health disparities in Rhode Island. Thank you.
Thank you very much. Any questions from the committee for Dr. Evans? Doctor, thank you very much for testifying tonight. It's appreciated.
Thank you.
You're welcome. Next up, we'll have Jonathan Scanlon. Jonathan?
Yes.
Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Jonathan.
Okay, I'd like to thank the Senate Finance Committee, and I would like to testify in support of Senator Lawson's Bill 327 about expanding SNAP benefits for fresh fruit and vegetables. As a SNAP recipient, I can attest to the fact that it's very difficult to feed oneself, much less a family, on less than $8 a day. I support this bill because it will both help local farmers in Rhode Island keep those dollars in the state and empower Rhode Islanders to make better decisions on the food they purchase.
Jonathan, thank you very much. Any questions?
Thank you.
Any questions from Jonathan from the committee? Jonathan, have a good night. Thank you. Escalara? Good evening. Is this Escalara Martinez?
Yes. Hi.
Escalara, welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated.
Okay. So I can start now?
Jimmy? Yes, go ahead.
Okay. I have to read everything I send by mail?
Go ahead.
Okay. Dear Chairman, Senator, House, and Community, as a resident of the district, I'm writing in support of the Senator Bill 327 as relating to taxation, sugary drinks introduced by Senator Lawson and House Bill 85717, introduced by Representative Barrows. This bill will make healthy food more accessible and affordable through the rental SNAP incentive program by providing a 15% discount on fresh fruit and vegetables. When I pay with my SNAP benefits, the SNAP incentive not only stretching my food budget, but also help improve the quality of my diet, my ingredients, access, and fund for healthy food. Not only is important for me, but also for my family members who live with me. Since fruits and vegetables are rich in flavor and very nutrition, they help our health a lot. They prevent many diseases, such as overweight, heart disease, diabetes, cholesterol, and many more. With the consumption of fruits and vegetables, we can have a longer and healthy life. We will also teach our children to eat fresh, low-sugar fruits and vegetables. We have to be aware and learn to eat this food as it will serve to better stay healthy. We have to come together as people and especially as parents to give our children better quality of life and all loved ones. I especially love to prepare fresh food with vegetables and fruits. This bill will continue to help improve my nutrition status and create foundation for healthy lifestyle. It's not incentive will improve my diet and overall health and stretch my budget to keep healthy food in my table. Please vote yes for this bill to fund and retain a SNAP incentive program and help make Rhode Island a healthy place for myself and my family. Sincerely, Escarla Martinez.
Escalara, thank you very much. Any questions for Escalara tonight?
No, thank you.
Escalara, thank you. Have a good night.
Okay, you're welcome.
Next up, we'll have Dr. German Velasco. Dr. Velasco?
Yes.
Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less would be appreciated. Over to you, Doctor. Thank you.
Great, thank you. Good evening, Senate Committee. My name is Germán Velasco. I'm a physician and board-certified endocrinologist. I'm a Hispanic resident of Barrington, Rhode Island, and I'm calling in enthusiastic support of Senate Bill 327, which would provide SNAP incentives that are funded by sugar drinks tax. As an endocrinologist, I see an overwhelming number of patients afflicted with obesity and type 2 diabetes. And as we know, consuming excessive amounts of sugars is one of the main risk factors for these illnesses. One of the senators was asking before whether there was an impact in sugar drinks and obesity and diabetes. And I can tell you that from the perspective of a physician that works on diabetes on a daily basis, I see this example every day. So if I see that my patients are consuming significant amounts of sugar drinks and they get rid of those, they drastically improve their diabetes numbers. They drastically improve their blood sugars. And this will have an impact on them as well, because then they'll be requiring less diabetes medications, less insulin. So the overall cost of their health and their expenses obviously goes down. So I think that by promoting consumption of healthy fruits and vegetables and reducing the consumption of sugary drinks, this bill will go a long way to advance the health and well-being of Rhode Islanders, particularly vulnerable children. I will also note that diabetes disproportionately impacts Hispanic children. Currently, there are not enough bilingual and bicultural physicians to take care of so many Hispanic children with diabetes. And I think that limiting sugar drinks and promoting healthy eating would go a long way to address these challenges and to prevent children from becoming obese and diabetic. On a personal note, I also believe that it's wrong and unethical that the beverage industry targets Hispanic children with predatory advertising. And I seriously believe that we must protect our children from these detrimental practices. I therefore enthusiastically support this legislation and the Bill 327. I'd be happy to answer any questions. Thank you for your time.
Dr. Velasco, thank you very much. Any questions from the committee for Dr. Velasco? Hearing none, Doctor, have a good night. Thank you very much.
Thank you. Have a good night.
Next up, we have Eliza, Dexter, Cohen. Eliza?
Hello, good afternoon, good evening.
Eliza, welcome to the Senate Finance Committee. If you could please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Eliza.
Thank you very much, and thank you for your time tonight. My name is Eliza. I am testifying on behalf of Tortolot and Company. We're a produce distributor based in Warwick, Rhode Island. We're speaking today to advocate in support of SB 327. We really believe that this bill will both contribute to long-term investment in the Rhode Island grocery economy and that it addresses one of the most important public health issues for our state. For over 150 years, Tortolot has provided fresh produce to grocery stores across the state, including both small locally owned stores as well as larger national chains. And we really have both a longstanding commitment to our colleagues in the industry to keep our businesses strong and continue to employ Rhode Islanders across the state. And we also have a really strong and longstanding commitment to public health and the well-being of our community. We don't see these as opposed to each other, but rather coming together in this bill as a no-brainer to push our state forward in terms of a sustainable food system and a strong food economy for the state. So the beverage industry will have you believe that this tax has the power to hurt the grocery industry and reduce jobs. And as other folks have said before in their testimony, this just isn't really true in the evidence and in the other instances in which we've seen these policies passed. And furthermore, because of the design with the SNAP incentive RSAP, we're really able to pass comprehensive legislation with this opportunity to capture the funds to support grocery industry in focusing on what we do best, which is provide fresh fruits and vegetables for our communities. The SNAP incentive program will increase spending power across the state for low-income families, and therefore this bill really represents an investment in Rhode Island's grocery economy, which is, really our priority in our work every day. I really want to point out that, so in Rhode Island, SNAP benefits are distributed at the beginning of the month. And for the grocers that we work with that serve the lowest income neighborhoods, businesses can show declines of as much as 20 or 30% in the last week of the month compared with the first week of the month. And what that means is that those families are spending less money at grocery stores because they can't afford food. That means that parents are skipping meals so that children can eat. People living with diabetes and other chronic conditions are facing increased risks of costly and dangerous hospitalizations. And those grocery stores are facing reduced income towards the end of the month. The SNAP incentive is going to help bridge that gap at the end of the month, increase purchasing power for our low-income neighbors, and close the revenue loss at the end of the month for grocers. We really think this represents an opportunity for Rhode Island to be a national leader and pass the first statewide SNAP incentive program. The bill is really going to invest in what our grocery industry does best, which is the sale of fresh and healthy food. We really encourage the members of the committee to support SB 327 and to invest in our local grocery economy through a strategy towards healthy food rather than letting our neighbors get sick and really suffer, especially during the pandemic. So I thank you for your time. We really are proud of the work we're doing in the grocery industry to promote healthy eating, and we ask you to contribute to this support through investing in this really important public health program.
Eliza, thank you. Eliza, thank you very much. Any questions from the committee for Eliza? Eliza, have a good night. Thank you very much.
Thank you.
Next up, we'll have Dr. Patricia Markham Risica. Dr. Risica or Risica?
It's Risica. Thank you.
Doctor, welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Doctor.
I will do that. Thank you for having me, Mr. Chairman and members of the committee, and also thank you to Senator Lawson for introducing this important bill. As you said, my name is Patricia Markham Risica. I'm a registered dietitian and a professor at the Brown School of Public Health. I'm also the advocacy chairperson for the Rhode Island Public Health Association. However, today I'm speaking for myself. As I raised my daughters, who are now grown, I knew that sugar-sweetened beverages like sodas, fruit drinks, and even our beloved Rhode Island sweetened coffee drinks are not healthy. Very little or no nutritional value is provided as we consume those liquid extra calories. We see the health effects in higher risk of childhood obesity and oral health among many different conditions that are affected. So it makes sense to avoid sugary drinks for better health for children and for adults. I'm very supportive of this Senate Bill 327 as a way to add more disincentive to purchase and consume these unhealthy drinks. However, I'm most in favor of this legislation because of the plan to use these funds to promote the purchase of healthy food options with SNAP benefits. An estimated 90,000 Rhode Islanders receive SNAP benefits. Food insecurity, which is being without reliable access to sufficient quantities of affordable, nutritious food, is a big problem in Rhode Island. More than a quarter of Rhode Islanders are food insecure, which is just astounding. Did you know that well over half of those are children and elderly? So these are the very neediest in our community. I personally volunteer at the local food pantry, St. Peter's by the Sea Community Market in my town of Narragansett. We don't often think about beach communities as having families in need, but they're certainly there, as they are in urban areas and throughout the state. I'm amazed at the number of families that come, sometimes weekly, to pick up a few groceries. The Rhode Island Food Bank estimates that 68,000 people are assisted at these outlets. But it isn't enough. We don't have enough at the food bank. We don't have enough many healthy options, and we never have enough resources to provide for a whole week's worth of groceries. And this, even combined with SNAP, these families still have few food options and are still food insecure. So the funds collected from the tax on sugar-sweetened beverages will be used to offset the costs of expensive healthy foods like fresh produce from farmers markets or even just at the grocery store. Please support this legislation to tax sugar-sweetened beverages for the benefit of providing more healthy options for the most needy in Rhode Island. And I thank you for your support of this important policy.
Thank you very much. Any questions for this witness? Thank you very much.
Thank you.
Next up will be Mark Tracy. So folks, we're just about halfway through. Good evening, Mark. Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, that would be appreciated.
All right. Thank you, members of the committee. My name is Mark Tracy. I'm the CEO of Cloud Agronomics. But what I want to speak to you tonight about is my 20 years, almost 20 years of experience in a variety of leadership roles with Cargill, Inc. For those of you who are not aware, Cargill is one of the largest food companies in the world. It's the largest privately held company in the United States of America. We employ some people here in Rhode Island down at Quonset Point. And I worked there as an assistant vice president. Cargill, if it was a public company, would be the 15th largest public company, just ahead of AT&T. It is also one of the largest producers and sellers of sweeteners to the beverage market. And in my experience there, I worked directly with farmers, but I've also sat down at the Coca-Cola corporate headquarters and worked with the folks there and other large beverage producers. And I can tell you with absolute confidence from that 20 years of experience that both Cargill and the other large producers of sweeteners have been working for the last 10 to 15 years very hard on a number of alternatives, zero-calorie, all-natural sweeteners, including one called Truvia, which you may be familiar with, which is made from the stevia plant, which is 0 calories and all natural. And then on the other side, the large beverage companies have also been preparing for this day for a long time and are extremely well diversified with a number of other sugar substitutes and other products. And so from my experience, I can give you full assurance that neither the beverage companies or the farmers or the companies supplying those beverage companies with sweeteners will be ill-affected by this bill. And so I urge you to give your support to Senate Bill 0327, which will address both the obesity epidemic and food insecurity in a fundamental way. Thank you.
Stand by. We're still trying to reach the next person to testify. We're trying the next one. Hang on. Which one are we up to, Jamie? Okay. We tried Margaret Holland McDuff, no answer. Dr. Jack Rusley, no answer. Thalia Riveria, no answer. Now we're trying to reach Dr. Michelle Forcier. It's 9:51. We'll be talking to Dr. Michelle Forcier. Stand by. Dr. Forcier?
Hi there, how are you?
Very good. Welcome to the Senate Finance Committee. If you can please keep your testimony to 2 minutes or less, it will be appreciated. Over to you, Dr. Forcier.
I can, and please forgive me, post-dental surgery, so my mouth is a little bit numb still.
Okay.
Let me be brief. Consumption of sugary drinks is linked to poorer health outcomes. I am a Rhode Island pediatrician and a mom, and I would say that sugary drinks offer no nutritional value for growing brains and growing bodies. Money generated by the sugary drink tax can be put back into low-income communities and communities of color. Overall, all children deserve to have the opportunity to have healthy food and healthy bodies. And I support any efforts that help get our kids the food and health they need. Thank you.
Dr. Forcier, thank you very much. Any questions from the committee for Dr. Forcier? Doctor, have a good night. Thank you.
Thank you. Good.
Next, we're trying Carrie Connolly. Okay. We're not able to reach Carrie Connolly. Next, we're going to try to reach Dr. Celeste Cochran. We're having Dr. Celeste Cochran joining us. Dr. Cochran?
Yes, Dr. Cochran.
Welcome to the Senate Finance Committee. If you can please keep your testimony to 2 minutes or less, we'd appreciate it. Thank you very much.
Thank you, and thank you to members of the committee for allowing me to speak tonight. My name is Celeste Corcoran. I'm a board-certified pediatrician and a board-certified obesity specialist. I'm a representative of the American Academy of Pediatrics in Rhode Island, the Rhode Island Public Health Institute Coalition, and I'm the chairman of the 5210 subcommittee of the Washington County Healthy Bodies, Healthy Minds. I am speaking in favor of Bill 327. I'm the director of the health clinic at Hasbro Children's Hospital. The health clinic is a clinic that cares for children who are struggling with their weight. And I'd like to speak to you a little bit about the children I see in my clinic. Most of the children we see in the clinic at Hasbro Children's Hospital are from the 4 core cities in Rhode Island. And I'd like to talk to you about some of these children. On a given day, I can see a 3-year-old suffering from obesity. I can see a 10-year-old little boy who already has non-alcoholic fatty liver disease. This is a form of liver disease that, if left unchecked, will become chronic and lead to liver failure, just as we might see in alcoholic hepatitis. I may also see a 16-year-old who already has type 2 diabetes, which was a disease we used to see only in adults. And what do these children have in common? Well, first of all, they have a chronic disease with complex medical problems, but they also are the victims of teasing and bullying by their families, by their peers, and even by their parents. And this victimization leads to low self-esteem, anxiety, and depression. And this severe depression can also lead to risk factors for suicide. When I see these children, I always ask them about their dietary history, and I ask their parents as well. And the vast majority of these children admit to increased sugar in their diet. And to a point that one of my colleagues made previously, this added sugar is mostly consumed in the form of sugar-sweetened beverages. And we have research that supports this, that it's not the sweet cakes and the bakery items, but it really is the sugar-sweetened beverages that contribute to this. And when I ask these children and their families about their fruit and vegetable intake, most of them will tell me that their intake is inadequate. And the main reason for this in these children that we serve at Hasbro Children's Hospital who come from the 4 core cities is that they're suffering from food insecurity. And most of them are SNAP recipients. And when I ask the families why they don't have, their children don't eat enough fruits and vegetables, they'll tell me that I really can't afford it. And the kids say, well, we don't really have those foods in our home. So I won't reiterate the science that supports the fact that added sugar in the diet leads to obesity, because this has already been stated. But I want to remind you that 30% of our children in Rhode Island are suffering with obesity, and more so in our clinic, which serves a very underserved population. 1/3 of those children are obese, with many more being in the unhealthy weight category. So therefore, I support this bill that truly incentivizes the intake of fruits and vegetables, which we know are healthy for children, and de-incentivize sugar-sweetened beverages. It's very important to me that as a state, which I love so much, that we stand up for our children who are suffering with a chronic disease. I thank you for your time tonight.
Dr. Corcoran, thank you very much. Any questions for the doctor from the committee? Seeing none, Doctor, thank you very much for your testimony tonight. It's appreciated.
Thank you.
We tried to really reach Dominique Brown, unable to. Next up will be Brian Moran. Good evening, Brian. Welcome to the Senate Finance Committee. If you can please keep your comments to 2 minutes or less, it would be appreciated. Over to you, Brian.
Thank you, Chairman. And members of the committee, my name is Brian Moran. I'm Director of Government Affairs for the New England Convenience Store and Energy Marketers Association. We represent convenience stores and gas station retailers and the businesses which supply them. Next, members own and operate or supply nearly 500 convenience stores and gas stations in Rhode Island and employ approximately 7,200 people. We've submitted written testimony and appreciate the opportunity to be able to speak in opposition to Senate Bill 327. We offer 2 main points for your consideration. The first concerns the regressive impact the proposed tax imposes on consumers, especially low-income families. Our second concern with the bill concerns the competitive imbalance this legislation will create for businesses within Rhode Island when compared to bordering states that do not have such a tax. If passed, consumers will become incentivized to purchase these beverages and other purchases outside the state, thereby resulting in lost sales tax revenue and loss of these sales by in-state businesses. We urge you not to support Senate Bill 327, and thank you for your thoughtful consideration. I'd be happy to take any questions. You bet. Thank you.
Next up, we'll have Paul McDonald. Is this Paul?
This is Heath, sir.
Paul, welcome to the Senate Finance Committee. If you can please keep your testimony to 2 minutes or less, that would be appreciated. Over to you, Paul.
Okay. Well, good evening, Mr. Chairman, members of the committee. It's always a pleasure to be with you, even from far away. Since I'm standing between you and whatever dinner you might be thinking about, my name is Paul McDonald. I'm Legislative Director of Teamsters Local 251. First thing I'd like to say that I heard someone say about a myth about losing jobs. Well, in Philadelphia, we've lost over 400 jobs that never came back. So clearly we are opposed to Senate Bill 327 for several reasons. Amongst them is the fact that it is another job-killing bill. The good-paying jobs that we all talk about, especially in the Senate, where families can put down roots, buy a car, build a home, and all the many pleasures of family, along with good pension, health plan, vacations. This is in jeopardy with this kind of stuff. And here's the catch. Soda sales across the borders of Rhode Island would increase dramatically. Massachusetts and Connecticut, come on, they're only a hop, skip, and a jump away. So trying to tax folks into good health is not the way to go, in our opinion. We work in the beverage industry, the Teamsters. It's a three-tier industry: production, distribution, and delivery of soft drinks. This is death by 1,000 cuts, as we always say around here. This hurts the working class and surely is not the way to go. With gasoline, lumber, groceries reaching prohibitive prices, not to mention the American dream, buy a house, this is just not the time to add taxes to an already struggling folks. In a sense, at least I think about it this way, the rungs on the ladder of opportunity will grow further apart, making it harder to climb the ladder of opportunity. I want to thank you always for your time, and I hope you will consider Teamsters Local 251's position and not support Senate Bill 327. I don't want to see us make a nanny state out of Rhode Island. There's other ways to accomplish what they'd like to accomplish. So I'd be glad to answer any questions if you have any, from the chair or the committee members. Thank you, sir.
Paul, thank you very much. Thank you for being with us tonight. Any questions from the committee? Senator Dela Cruz.
Mr. McDonald, I'm glad I didn't hop in my car and miss you. So happy to hear from a constituent. And I know that the unions and Republicans don't always agree, but I think we can agree on this, that this is not the best piece of legislation. So I'm happy to support you in voting against this piece of legislation. I wanted to point out, because you had mentioned purchasing sugary drinks across the border. Rhode Island is so small that a lot of people in my district do grocery shopping in Connecticut. And when I lived in East Providence as a young person, I frequently bought my groceries and clothing in Seekonk, Massachusetts. They were, Seekonk was a cheaper option, even for gas. So I just wanted to point out a researcher at Northwestern University, Anna Trushman. She found that the sales of sugary drinks dropped by just 20% in Philadelphia, rather than the stated 46% when cross-shopping was factored. One of the callers, he was calling in from Philadelphia, so I just pulled up this information. It says here, although Philadelphia leaders still tout the tax as successful in reducing sugary drink consumption, a Stanford Business School study found that people cross-shopping outside city borders to avoid the duty reduced the stated net decreases in sales. The study also found that an increase in purchases of untaxed drinks like milk kept caloric intake rather high, because people forget that milk is actually pretty sugary. Furthermore, Stanford discovered that the richest households saw the biggest drop in consumption of sugary drinks, while impoverished families who are more likely to be obese found it more difficult to avoid the tax. This is according to the Northwestern University. So I will echo those sentiments, Mr. McDonald, and thank you so much for calling in.
Thank you so much.
Thank you very much, Senator. I appreciate your remarks. Thank you.
Thank you, Senator.
Mr. Chairman, can I ask a question, please?
Thank you, Senator De La Cruz. Senator Acosta.
Thank you, Mr. Chairman, and thank you, Mr. McDonald. I have somewhat of a three-pronged question. The first is the distribution site that the majority of the employees you represent work. Do they only distribute to Rhode Island, or do they distribute to neighboring states? Because if they distribute to neighboring states and the pushing out of the product or the consumption from somewhere else wouldn't really affect the jobs aspect. Now, digging a little deeper here, we had someone testify, maybe half an hour ago, saying that a lot of the beverage makers have already been experimenting with alternative sweeteners that might not fall under this category. So you could ostensibly still be making some sort of, quote, sweet drink that you could sell that wouldn't be taxed in this way. And the final question, somewhat related to that, is that the presumption is that this tax would totally shut down any operation. But it sounds like the folks that you represent could be making other beverages. I mean, presumably if people stop drinking soda, they got to drink something. So if they're not drinking out of some kind of addictive compulsion because of their addiction to sugar, they'll still need to have some kind of intake. Is there the possibility that you might produce something else?
Well, Senator, you've asked, well, I'm getting feedback here. Okay. Senator, you've asked me three questions, and quite frankly, it was a little difficult hearing you, but I can say to you that, for an instance, the Teamsters in Cranston, they bottle and distribute and truck the Pepsi Cola all over the state, and out of state too. My understanding is that if this bill was to pass, there'd be some consideration of closing that plant. Those are Teamster jobs. Look, this is not a good bill in terms of trying to drive people to good health. I understand all about the SNAP. In fact, I like the SNAP program. It's a very important program. But if we're going to tax our way to that, then there are plenty of other things to tax too. We can start taxing apple pies, for instance, or I can go on and on. So that's a real problem for us. In Philadelphia, this is a really regressive beverage tax in Philadelphia, and it's not over in Philadelphia. Now they're in the courts and may very well end up in the Supreme Court opposing these bills. These are job-killing bills. There's no way around it. And if you're really interested in good-paying jobs, jobs where people will make a foundation in their lives, you wouldn't support this.
Thank you so much, Paul. Senator Palmer.
Paul, I should have mentioned earlier, thank you for being with us tonight. I think you had a birthday yesterday, so happy belated birthday. So.
Oh, thank you very much. I'm looking forward to the next one, to be with you.
Absolutely. Thank you, Chairman.
Paul, I am told it was your 40th birthday, so happy 40th, my friend. And,
thank you.
It is always good to hear. It is always good to hear from you.
Oh, nice to see you, Chairman. I haven't seen you all week.
we only come for you, Paul.
Well,
so,
thank you. Good to see you.
Thanks so much, Paul. Thank you for your testimony.
Thank you.
Next to testify is going to be Carolyn Murray, representing the Rhode Island Beverage Association in opposition. Carolyn, welcome to Senate Finance.
Good evening, Mr. Chairman, members of the committee. This is Carolyn Murray representing the Rhode Island Beverage Association, the trade association that represents the non-alcoholic beverage industry in Rhode Island. Our industry employs more than 600 workers in Rhode Island and pays more than $41 million in wages annually. Our members include Coca-Cola Beverages Northeast in Providence, Pepsi Bottling Group in Cranston, Nestle Waters North America, Keurig Dr. Pepper, and Polar Beverages. On behalf of the association, we respectfully oppose S327. It's very important to know that this is not just a soda tax. This tax would increase prices of sports drinks, juice drinks, iced teas, coffee drinks, lemonade, energy drinks, and flavored waters. It will also tax coffee milk syrup, the official state beverage. It's hard to understand why one item in your shopping basket would be deemed unhealthy and therefore assessed a sin tax. This tax will hurt folks that can least afford it. There would be an additional $2.40 tax on an 8-pack of sports drinks, or a 12-pack of lemonade, which costs about $3.50, would have a $2.16 tax. This proposed tax will hit all of us, but the hardest hit will be the restaurants and small businesses that survived COVID. Restaurants and convenience stores that serve fountain drinks would see the 5-gallon syrup bag taxed an additional $57.60 on an approximate $100 item. This bill is written so that the tax is mandated to be passed on to the consumer. Again, the folks who can least afford this will be affected. There is a better way than unproductive taxes to help people reduce the sugar they get from their beverages. Beverage companies have put competition aside and are using their strengths in product innovation and marketing to create more choices with less sugar and smaller portions to help support families' efforts to balance their calories. I encourage you to look at the changes in the beverage aisle today. There are more choices than ever before to help consumers reduce their sugar calories, such as lower-calorie sodas, no-calorie drinks, iced teas, and juice drinks, to name a few. I have provided written testimony with more detail about the bold actions and initiatives that the leading beverage companies are working on to reduce the sugar people get from their beverages. Because of the late hour, I will defer to my written testimony, but in closing, I ask that you support your local beverage companies, retail stores, grocery stores, convenience stores, and restaurants. And I also ask that you do not support Senate Bill 327.
Thank you so much, Carolyn, for your testimony this evening. We do appreciate it. Next to testify is going to be Carrie Connolly with the Rhode Island Public Health Institute in support. Carrie, welcome to Senate Finance.
Hi, thank you for having me.
Please proceed.
Thank you. I would like to thank Senator Lawson for her leadership on this bill, as well as co-sponsors, Senator Acosta, Senator Cano, Senator Cohen, and Senator Murray, and Senator Sanowski. I'm testifying tonight as the Food Access Program Manager for the Rhode Island Public Health Institute. I've been on the project lead on this bill this session, and I have spent every waking hour fighting for this legislation, and not because I have a corporate bottom line that I'm worried about, but because I know what it's like to be a kid that was hungry. I grew up on SNAP. I'm the daughter of a single mother who was a working adult in society. She had 2 jobs, but we used SNAP to get by every month. And I know what the end of the month hunger feels like. I know what it's like to have pasta and ketchup nights, and I know what it's like to have breakfast for dinner out of a box of pancake mix because that's all that was available. I know what it's like to see my mother skip meals. And this bill would go such a long way for people in Rhode Island, for kids like me that experienced that growing up. The scientific evidence that this is an economically sound public health policy is overwhelming. There are several studies that refute the claim that this is going to cost job loss. In Philadelphia, they were just released. Over 2-year and 1-year period of time, there is no job loss. The 400 number that was quoted earlier, I would like to see evidence that that is related to a tax and not something else within the economy. I've heard a lot of things come from the opposition so far, but I haven't seen actual scientific evidence that is noteworthy. The studies that were quoted before were not in scientific peer-reviewed journals, and they used data from years back. So I encourage everybody to please, when you are referencing the bill, to look for the scientific data that is in peer-reviewed journals. If 2020 has taught us anything, it's that making public health policy not based on science can lead to a disastrous outcome. Right now in Rhode Island, we are having a hunger crisis. Not once has the opposition talked about how this bill pairs with the retail SNAP incentive program. Their cross-border shopping that they're worried about, their regressivity they're worried about, this money is going directly into the communities that sugary drinks impact the most, the communities with the highest rates of diabetes, with the highest rates of chronic conditions. I urge you to look at the evidence. It is highly unlikely that somebody who may be affected by the tax but is then receiving 50% off of their fresh fruits and vegetables at the grocery store is going to go to another state to buy their groceries. You've heard from produce distributors tonight. You've heard from grocery retailers tonight. Please believe in the evidence and in support of SB 327.
Thank you. Thank you, Carrie, for your testimony this evening. We do appreciate it. Next testify is going to be Bree Deatley, representing Northbridge Environmental on behalf of American Beverage in opposition. Bree, welcome to Senate Finance.
Thank you, Chairperson and members of the committee. I appreciate your time this evening. I'm testifying. My name is Bree Deatley. I'm a principal at the Northbridge Group in Western Massachusetts, and I'm testifying on behalf of the American Beverage Association. We work closely with the Rhode Island Beverage Association as manufacturers and distributors of refreshment beverages. As I have an economics background, I'm going to talk primarily about the business and consumer aspects of the legislation, which we are opposing. I do want to point out at the outset that relatively few jurisdictions in this country have adopted taxes like this. There are no statewide taxes like this in this country. And in fact, there are only 7 communities, 4 in California, and 3 scattered around the country that have similar sweetened beverage taxes. So these have by no means been found popular by a lot of legislators and other states and local governments. I do want to talk about the significance of the tax. Several folks have talked about the percentage increase in prices, and in my written testimony, there's some documentation of what the impact would be on the average consumer. And if you look across the portfolio of the teas and sports drinks and other beverages that would be subject to tax, on average, the price of those products would go up by 26%. Now, there are some pretty dramatic examples that are shown in my testimony where prices would more than double, and some that are less dramatic. But on average, that's a very significant price impact that's going to drive a lot of consumer behavior. That consumer behavior affects businesses in a couple ways. One, you've heard from small stores, the convenience stores and others, there is going to be a significant lost sales impact on businesses in the state. We estimate, given the magnitude of the tax, about $100 million in lost retail sales to businesses, and that's not just retail stores, but movie theaters and restaurants and sandwich shops who would lose sales as a result of higher prices. You've already heard a little bit about cross-border impact, as consumers are driven across the borders, as they were in Philadelphia, for example, where sales are lost in the city, but they're made up because especially consumers who are mobile and have the resources can cross state lines and buy their products elsewhere where they're not subject to the tax. And that really brings me to the final point. The fact that this really has such a dramatically differential impact on people of different socioeconomic levels. Folks who are wealthier in Philadelphia can leave and go out to the suburbs and do their shopping, and that's why sales of beverages that are taxed have gone up in the suburbs of Philadelphia. But folks who don't have that kind of transportation, who have to take the bus to the store or shop in small local convenience stores, don't have that alternative. They're the ones that pay the tax. If you look at the incidence of the tax, in my testimony I've shown that about a third of the consumers who would pay this tax, or a third of the households, would be under $40,000 in household income. That's where a third of the revenue would come from. This is an extremely regressive tax. It would have a big impact on a lot of consumers and hurt businesses in Rhode Island and benefit those in neighboring states. So we encourage your opposition to Senate 327. Thank you very much.
Thank you so much, Bree, for your testimony. Next testify is going to be Joe Maggiacomo, representing Coca-Cola Beverages Northeast in opposition. Joe, welcome to Senate Finance.
Hi, good evening, Chairman, members of the committee. Thank you for allowing me to testify before you tonight. My name is Joe Maggiacomo. I'm a lifelong resident of the state of Rhode Island. I'm also a sales manager here in Providence at Coca-Cola. Coke has been a presence here in Providence dating back to 1940, when the company opened the facility here on Pleasant Valley Parkway. I'm before you tonight to testify in opposition to the Senate Bill 327, which would impose an excise tax of 1.5 cents per ounce on hundreds of popular beverages. Coke and other beverage companies in Rhode Island have an overwhelmingly positive impact on the state's economy and its communities. A tax would put good jobs and hardworking businesses in jeopardy at a time when it can least afford it. We, as other companies, are committed to helping people consume less sugar from our beverages, and I believe there are more comprehensive and effective ways to achieve this goal that do not hurt local job creators, the Rhode Islanders who are already struggling to make ends meet. 1.5 cents per ounce might not sound like much, but it adds up. Under this proposal, every time you take a sip, essentially you're going to pay a tax. All right, and it includes things like lemonade, juice drinks, sports drinks, and enhanced waters. I know Senator Dela Cruz brought up the tax on the actual 2-liter bottle of soda. That is correct. The 2-liter bottle of soda that costs $1.25, for example, carries a tax of $1.01. That's an 81% increase, bringing that cost to $2.26 for a retail price. So the tax would be especially burdensome on restaurants and businesses that buy concentrate for fountain drinks. A box of syrup would carry just about a $58 tax, which is calculated on the amount of finished product that the syrup makes. The tax in these cases would almost be the cost of the concentrate itself. Our local restaurants have been significantly affected during this pandemic, and this tax would cause further damage to an already suffering industry. We simply can't afford to take steps backwards with a tax like this. Rhode Island, we currently do, and people have brought this up on the previous testimony, that we do have a competitive advantage over our neighbors in Massachusetts and Connecticut. They have a forced deposit of 5 cents on a beverage container. The proposed tax would significantly raise the price of drinks in Rhode Island. It could encourage shoppers in border communities to take their business elsewhere without such high taxes. So I hear Philly. Philly, for example, did pass a beverage tax in 2016. Okay, supermarkets in Philly fell 24% in year one, where it took effect. The sales in the same products in other neighboring cities rose 14%. So the sales did move over. Philly tax was also unintentionally led to a reduction of sale of other food items, such as grocery shopping of normal fruits, vegetables, and other items in the city. This could easily happen here and would be detrimental to both businesses like ours and local economy. So here in Providence, our facility employs almost 225 employees, and we have an annual payroll of about $16 million. These are good jobs with benefits for hardworking people and their families. Our associates volunteer in organizations like the Providence YMCA, Special Olympics. We get involved in community initiatives with the Woonsocket River Watershed Council and the River Cleanup, Earth Day, Rain Barrel programs. We're even partnering this year with the Providence Neighborhood Planting Program that really is trying to give back and plant trees in the city of Providence. But we take pride in servicing 3,000 customers in our Providence Sales Center, and the success of each and every one of those businesses does matter to us. Many of our customers are small, independent markets and restaurants that are running on thin margins and have been significantly impacted this last year. Neighborhood grocery stores and independent markets, restaurants, and other local businesses often rely on beverage sales for a good portion of their income. We shouldn't penalize people that are working hard to make a living. A tax like this would hurt the working families because it places a much larger share of the burden on residents who are least capable of paying it compared to wealthier households. We recognize that too much sugar isn't good for anyone. That's why we offer and actively promote a wide variety of beverages with less or no sugar, including smaller portion sizes like 7.5-ounce mini cans. As a local bottler, we have more than 160 low or no sugar options in our portfolio alone, and Coca-Cola is continually developing new drinks in this category. We would be happy to host you at our facility sometime in the near future to show you our portfolio variety and introduce you to some of our associates. We also have ramped up our educational efforts and marketing to further raise awareness of beverages with less sugar, providing messaging in both English and Spanish. This is a collaborated effort, an industry effort, and collectively we are striving to reduce beverage calories consumed per person by 20% in 2025. And in closing, taxes don't make people healthier, but they certainly make it tough for businesses and residents in Rhode Island. Awareness, education, and a message of moderation in consuming all sugary products, not just beverages, is a far better bet for improvement of health outcomes. I urge you to join us in opposing this regressive tax proposal. Thank you again for your time and consideration.
Thank you, Joe, for your testimony this evening. We do appreciate it. Next
Thank you.
testify is going to be Ken Mencuso with the Pepsi Beverage Company in opposition. Ken, welcome to Senate Finance.
Thank you. Thank you, Chairman Pearson and the committee members. My name is Ken Mencuso. I'm the plant director at the Pepsi manufacturing facility in Cranston, Rhode Island. I strongly oppose Senate Bill 327 for the tax on beverages in Rhode Island at a new and extremely high rate. No matter how well-intentioned this may be, this is a poorly conceived tax. It's introduced at the worst possible time, and it will harm our Rhode Island small business, stores, restaurants, and consumers. This tax will adversely affect my workforce and the customers it serves. I lived in Rhode Island all but 8 years of my life. I was born and raised here. I'm a graduate of the University of Rhode Island, and I'm also a proud member of the Pepsi family for over 33 years. I'm extremely proud of my productive union workforce and other colleagues that work and live across the state of Rhode Island. I represent these frontline heroes who worked tirelessly during this pandemic to ensure our retailers and customers were stocked with the many products we offer. This tax undermines their efforts and the sacrifices they've made during this past year. We know that this tax will generate revenue, but is this revenue really necessary considering the large amount of funding the state's going to receive from the federal government, the grants that the state and local cities will obtain from Congress? You know, there are signs that the economy is on the rebound. Don't hurt it with this new tax on our family restaurants, our store owners, and the people of the state who've had a pretty difficult year. You know, this tax affects so many products that it's a miss of complexity. Again, someone had mentioned it's a state drink in Rhode Island. It's coffee milk. It will be taxed under this bill. Juice drinks, teas, and other products. And also the tax rate is really high, 1.5 cents per ounce. That is 19 times greater than the Rhode Island beer excise tax. Our industry history tells us that these taxes do not affect how people consume. It's where they purchase, especially in Rhode Island, where we're so close to the borders of Massachusetts and Rhode Island. In closing, I'd just like to say this. Over the years, I've heard many elected officials talk about attracting companies that offer good-paying union manufacturing jobs to the state. You have one here located in Cranston, Rhode Island. I ask that you reject this bill and preserve the jobs and investment our company provides in Rhode Island. Thank you very much.
Thank you so much, Ken, for your testimony this evening. We do appreciate it. Next testifying is going to be Lynette Forey-Menard, representing the Northern Rhode Island Chamber of Commerce, in opposition. Lynette, welcome to Senate Finance.
Good evening, Chairman. Thank you for the opportunity to testify. I realize it is extremely late. I will be very brief. You've heard, in essence, what this bill does, the tax that goes on to soda, syrups, sports drinks, energy drinks, sweetened iced teas, coffees. And you've heard what the tax means to businesses and consumers. A 5-gallon bag in a box used by many businesses in fountain drinks would be taxed $57.60. A 12-pack of canned soft drink would be taxed $2.16. A 2-liter bottled soft drink would be taxed at $1.02. The Chamber believes this tax will be hurtful to businesses and will be hurtful to consumers who can easily cross the border to Mass. I will tell you I'm sitting in North Smithfield right now, and I am 2 miles to the closest Rhode Island Stop and Shop, and I am 1.5 miles from Park and Shop in Massachusetts. I'm closer to Massachusetts. And that is the case for many businesses, restaurants, grocery stores, retail establishments, convenience stores here in northern Rhode Island. So for these reasons, the Chamber of Commerce opposes this. The passage is 327, and I'd be happy to answer any questions.
Thank you so much, Lynette, for your testimony. We do appreciate it.
Thank you, Chairman.
Next testifies. We had two individuals sign to testify, but we were not able to reach them. Ben Rajadorai from Americans for Tax Reform in opposition, and Dennis Bolio with Local 513/PBNA, also in opposition. We were not able to reach those two witnesses. And if the committee could just stand at ease for just a minute. We also tried to reach Jessica Salter with Amos House in support, but she was not available. And next to testify is going to be Katie Arona with Rhode Island Kids Count in support. Katie, welcome to Senate Finance.
Hi there. Thank you. My name is Katie Arona. I'm the health policy analyst at Rhode Island Kids Count, and I would like to offer our organization's strong support for Senate Bill 327. We believe that imposing a tax on sugar-sweetened beverages is a key method to addressing the upward trend in obesity among Rhode Island children that we are seeing. A study led by Rhode Island Kids Count in 2018 of over 65,000 de-identified records of clinical and related billing code data found that 13% of Rhode Island children ages 2 to 17 are overweight and 17% are obese. In addition, we also believe that this bill will increase SNAP recipients' purchasing power. The average monthly SNAP benefit for a family of 3 in Rhode Island was only $393 last year. Establishing a retail SNAP incentive program would increase the purchasing power of low-income families and empower them to make healthier purchases while stretching their dollars. We would like to thank Senator Lawson for sponsoring this important piece of legislation and encourage you to pass this bill. Thank you for your time.
Thank you so much, Katie, for your testimony this evening. We do appreciate it.
Thanks.
Okay. Also signed to testify was Sarah Bratko with Rhode Island Hospitality Association in opposition, but she was not available. That does conclude our witness testimony for this evening on Senate Bill number 327.
Motion to hold.
Senator Palmer makes a motion to hold.
Second.
Second by, I think I heard Senator Acosta and Senator Murray. Will the clerk please call a roll?
Chairman Pearson.
Yes.
Senator DePalma.
Yes.
Senator Paolino.
Yes.
Senator Acosta.
Yes.
Did I say no?
Senator Cano.
Yes.
Senator Murray.
Yes.
Senator Seveny.
Yes.
Senator Sosnowski.
Yes.
Senator Dela Cruz.
Yes.
Nine in favor, 0 opposed.
Thank you, Mr. Clerk. I'd also like to ask the clerk if you would please record my votes in the affirmative on the motions to hold for Senate Bill 326, 362, and 367. That does conclude our business for the evening. Senator Palmer makes a motion to adjourn, second by Senator Murray.
Second.
All those in favor?
Aye.
Aye.
We are adjourned. Thank you, everyone. Have a good evening.